Hey everybody. Families are often relieved when their loved one is admitted from the emergency room into the hospital. We'll just call it the regular hospital. It feels calmer. There's not as much going on. It feels more controlled. But for persons who are living with dementia, the hospital admission is actually the hardest part. So the nights are noisy, the staff rotate constantly, and there's a risk of delirium with the disorientation. So today we're going to talk about how to set up the room, how to prevent delirium, and protect your loved one's dignity during the stay as best as we can. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I've been partnering with the Council on Aging in St. Tammany for over 11 years, mainly as their caregiver support group facilitator each Tuesday evening, but also in bringing you caregiver coffee conversations since 2020. So I'm so glad that you're here. Super important topic. Can't wait to dive into it. Before that, just a little spiel that I usually give for our caregiver support group. If you're here in St. Tammany Parish, so it's every Tuesday evening from 6 p.m. to 7:30 p.m. Sometimes we're in person in Slidell or Covington, and the other Tuesdays we are virtual via Zoom, but we don't ever do a hybrid where we're both in person and online. The best way to get connected with us, besides calling one of the Council on Aging senior activity centers, is to visit coastseniors.org and navigate over to the caregiver information. There you will see that we have a 2-month flyer that we publish, meaning that it's a calendar on a flyer. It covers 2 months, and then the next month or the next 2 months we publish the other one or the next one. So you can always check there. But I also encourage you to join the private email list that will get you reminders every Tuesday morning as to where we are. And if it's via Zoom, you'll get the Zoom link. And when we come out with a new 2-month calendar, you will receive that via email. So it's a good way of staying connected. And sometimes there are other resources that we find out about. We'll send that out as well with that. So if there's like a senior, if there's a caregiver fair, senior caregiver fair, that sometimes happens each year. We'll let you know when that is. So I encourage you to do that. Before we jump into this topic, one last thing. Remember that this is not medical advice that can only be personally offered to you from a provider. So please just take this, even though this is backed up by evidence, and I will share the sources in a moment. Just remember that you and your loved one are unique persons, and you have unique needs and bodies and minds. And so you deserve to have a personalized assessment and advice. But all of the stuff here is to be taken as education and advice, but with caution. So anyway, all right, enough said about that. And speaking of that, the information that we're talking about in this video, it is drawn from the Hospital Elder Life Program, also known as HELP. It was developed by Inouye and colleagues, and it's the leading evidence-based model for delirium prevention in hospitals for older adults. Additional information comes from the Alzheimer's Association 2025 Dementia Care Practice Recommendations, as well as the National Institute on Aging, and the Institute for Geriatric Nursing with the Hartford Institute and the Institute for Healthcare Improvement, or IHI, which emphasizes orientation, mobility, hydration, sleep protection, and caregiver involvement throughout inpatient care, which is what we're talking about. I should also say this is part 2 of a video that you may also see on the channel. Part 1 covered the emergency room and how to prepare for that, mainly preparing a go bag and what to do with it, how to act, how to protect your loved one for the best possible scenario in the ER. And this carries over, assuming there was some kind of admission. So I encourage you to go back and watch the ER video if you haven't already, and then continue with this one. So however order you want to do it. All right, so let's get into it. So why are hospital admissions different from the emergency room that we focused on last time? Well, the ER can be chaotic. It can be loud and fast, whereas a hospital admission is going to be quieter, but can be more disorienting. Nights can be especially confusing. Sleep disruption certainly prevents an increase to delirium risk. There could be new medications that are prescribed, new procedures, and new routines can add stress. Families often assume that admission is the safe part because it is quieter, but it's actually the most vulnerable phase, especially for delirium. So admission is where confusion can deepen, but it's also where prevention can happen and matters most. So let's talk about that. And starting with the setting up of the dementia-friendly hospital room, we'll call it. So you want to have orientation clues like a clock. A calendar can help if you're able to bring that. Sometimes there's a whiteboard with information on that. Your loved one may or may not be able to see that from their vantage point. Sometimes the whiteboard is mainly for the staff, for passing on information to the next shift. If there is a window, and hopefully there is a window, keep those blinds open during the day. That sunlight is really going to help with orientation. Familiar photos, any spiritual items that can provide comfort, rosary, prayer card, cross, crucifix, other things that they may have in their home that provide comfort. You can even have a small sign that just simply says, "You are safe. Your family is here." So they can look at it at any point. And that's assuming that they're still able to read, and many persons living with dementia can do that. So we're gonna assume that, and even if you're not sure, it might be good to have. Think about comfort items, and this is where you're going to start to sense a little overlap between the last video and this one because you're going to be using many of the same items, which is really good. A familiar blanket or a sweater or a hoodie, quilt, something like that. A weighted blanket could be comfortable. Soft music, just kind of like background music, white noise or nature sounds, or you can even do what we talked about many times in previous videos, meaningful music. So meaning songs and albums that certainly provide comfort. They remind someone of a certain time or a person, an event, relationship, things like that. A favorite pillow, a stuffed animal, favorite or personal toiletries, because that smell, that familiar scent of from any of the things that they are used to using, even like deodorant, can help reduce anxiety, can help build this familiar environment. Reduce clutter if possible. Keep surfaces simple, like just what is needed. I've gone into hospital rooms before, and there's just like lots of stuff on that table. Drinks and plates and all sorts of stuff. So keep that simple if possible. Remove unnecessary items. Organize belongings in one visible spot. As far as positioning, if possible, face the bed towards the window or a calm area. Sometimes this is possible and sometimes it's not. Avoid facing busy hallways, same thing. We're just trying to do that, trying to build a familiar room and environment that becomes an anchor for your loved one. All right, let's shift into delirium prevention. These are principles from the HELP program that I mentioned earlier. So orientation, reassure your loved one frequently, use names instead of pronouns, remind them of the day, place, and the reason for their stay. If your loved one can't see the whiteboard or the whiteboard is strictly for the staff, think about bringing one in. Of course, you may not be able to hang it, but you might be able to have it somewhere they can see it. Mobility, encourage walking with assistance. So your loved one could be already at a fall risk. And usually they have those non-slip socks. So you want to certainly make sure that those are on, and just be there to support your loved one as they walk in the room or down the hallway. Avoid long periods in bed if possible. Ask for physical therapy if appropriate already. And with all these things, we're advocating, we're asking, we may get some things, some may be later, but just don't be afraid of asking wrong questions. Just go ahead and do it. Hydration and nutrition. Offer water regularly. You can flavor it if needed. Actually, have I don't know if you can see this with a blurry screen, but that's something you just put drops in. That's something easy to have in your backpack. Bring familiar snacks, that they like. Watch for signs of dehydration. So discolored urine, Yeah, that's one of the biggest things. Um, what was I going to say? Oh, speaking of urinating and getting up, get your loved one up if they're able to. I'm not saying it's comfortable, but if it's physically possible, get them up to go use the bathroom instead of using a catheter unless it's absolutely necessary and recommended by the medical staff. All right, sleep protection. This is huge. We all know what it's like when we can't sleep, you know, and we don't have a cognitive impairment. So things can get a lot worse for your loved one with sleep interruption for them. So dim lights at night if possible. Ask the staff to cluster nighttime tasks. So you know they're going to come in, they're going to, you know, sometimes take blood pressure, or these days it's a cuff, a blood pressure cuff that's on a timer. Those can be set from, you know, up to like 30 minutes, an hour. So see if those can be engaged, or that they can automatically be um, clustered together with other things that are happening where they're going to be woken up, and see if you can avoid or make the stretch between between those longer. Reduce noise. You know, see maybe they can turn the beeping off and only just have an alarm sound at the nurse's station. I'm not sure, but it's worth asking. If that's not possible, think about earplugs, white noise, even earmuffs, non-industrial ones that we talked about in video one. I'll even, you know, offer this as an idea. So if lights can't be dimmed, it's possible to, but still possible to turn off the lights. You can get one of these. You can get a pair of these off of Amazon, I think for $10 or $15. They're LED charged. Um, I'm sorry, they are LEDs. They are charged with a charger, and it comes with a cool remote control, which I don't have with me, that you can use to lower into different degrees. This is 100%, and this is much dimmer. But if you have the remote, there are other gradients, and it even has a magnet. Like I'm sticking it on my computer right now, so that's pretty handy. You can stick that on the you know, the metal of the bed, or on the tray if there's like a wheeled table tray. Avoid restraints and sedatives. Restraints which are very rarely used. Um, there are laws against restraints, generally speaking. Restraints should be rarely, if ever, used. They increase delirium. Sedatives should be avoided if possible. We do have to consider the medical advice, but sedatives should be um, avoided if possible because they can worsen confusion. Ask for alternatives such as a sitter. Ask if more family can be present at all times, and offer mobility support. For pain management, untreated pain, just remember that can trigger agitation. Ask for non-sedating options when possible. So delirium prevention is not complicated, but it can be hard to engage. You have to stay on top of things. So it's really just about consistent and calm care. So how can you advocate without being pushy? Because we want to be kind, we want to be respectful, and at the same time, we have to speak up for our loved one who does not know who likely does not know these things, and if they do, they cannot advocate for themselves in this vulnerable situation. So some collaborative language ideas are: what is the safest option for someone with dementia? So using that phrase. Another is, can we dim the lights at night? Can we reduce nighttime interruptions? Can I be present during procedures? Can we avoid sedating medications unless absolutely necessary? And can you let me know before? Keep a notebook to write down your questions so you can track symptoms, so you can record medication changes. So all of this information is going to help you look for patterns. So if there's something that does happen, you can look back and look for potential causes. Also note who enters the room and when. Be present when possible because your presence can reduce agitation. You can help interpret behaviors. Your loved one's behaviors you can interpret. whether it's verbal or just expressions or, what have you. You know your loved one much better than they do. And you can provide continuity between shifts in case any information is lost in between or not communicated to the next one, and you kind of pick up on it. What to expect during recovery. There can be a temporary worsening. This can be normal. This is increased confusion, sleep disruption, emotional sensitivity, reduced appetite, and slower movement. And some return to baseline within days, but others can take weeks. And delirium can linger, so you want to watch it carefully and keep in contact with the medical team. Presumably, when you leave, it's going to be the primary care doctor of your loved one. Reestablishing routines. This is important to do as soon as you can after discharge. So establishing that meal routine that you had, establishing the sleep routine, hydration, familiar environment and activities, gentle activities, and familiar faces around them. And often it's not linear, the recovery, but it is possible. So that is the goal. So discharge planning. So this is before you leave. So you want to look at medications, follow-up appointments, safety at home, and written instructions. So for medication reconciliation, what changed, what may have stopped, what is new, and what are the reasons for them? And are these going to be expected to be, is it anticipated that these are medications that are going to be needed for the duration of this person's life? Or are these just, a few weeks, a few months, so kind of get an idea of that. Follow-up appointments, primary care, any specialists, will there be any kind of therapy? Occupational therapy, physical therapy, speech therapy, and others. Home health, will home health be prescribed? Does your insurance cover home health? And what kind of things will they be able to do? And just a reminder, you have the right to pick your home health company. There are many out there, just like there are many hospice companies. So you have the right to interview and choose who you want to. You don't have to take or accept who the nurse or the doctor or the office may recommend, or I'm not even sure if they can recommend, but sometimes people ask for recommendations and they're like, hey, I have these brochures. So, but just know that you can choose that. So think about safety risks at home, like new risks based on your loved one's hospital stay and potential or definite delirium. There's increased risk for falls. There are increased for dehydration. Think about sleep. How are you going to make that safe for them? If they would get up in their current state, if they were able to get up, are they at a fall risk right after sleep? And then you want to monitor for lingering delirium. For as far as the written instructions, and this is typically the case, you want to make sure you have everything written. Usually you'll get an after visit summary, you'll get a discharge instruction. So just make sure you have that and put that in your binder, your folder where you can access it. This is a good time when you're getting discharged, this is a good time to ask questions, even though you may be very eager and your loved one may be very eager to leave. Try to think of some questions and know who you will call but when you think of questions, or if there is a worsening of symptoms. Sometimes it's going to be the primary care doctor. Sometimes it might be somebody actually at the hospital. So ask those questions and find out, and take your time. Use the time that you need. You have the nurse or other personnel right in front of you, and it's good to ask them. In closing, hospital administrations are stressful, but you can protect your loved one, and anything's really going to be better than not using any of these tips, if that makes sense. So pick these out, watch this video again, take some notes. You can look up information about HELP, which is the protocol that we've been talking about, that we've been drawing this information from, as far as delirium prevention and what to do if there is delirium. This prevention is very powerful. Medical staff know that it's possible, and I can see them certainly cooperating with you as somebody who is informed and respectful and an advocate for your loved one. So I encourage you to do that. I feel like it's going to be a positive experience with you engaging with this information. So I hope this was helpful. I know it was a lot. I probably went really fast. I'm not sure how long this video has been going, but I hope that it is helpful. I hope you find some things. Did I leave something out? Did I misstate something that you've read or is based on your experience? Certainly put something in the chat, whether you see this on Facebook or YouTube. If you have ideas that you found comforting and helpful in your experience in the hospital, let us know that also. I encourage you, if you enjoyed this and you found it helpful, to share it with others. You never know when this information can be used in your own care in the future. So thanks again, and thanks for supporting the Council on Aging in St. Tammany, and I look forward to you seeing more videos and helpful tips in the future. Take care.